How do you feel about the idea of masking up again? That's what some San Francisco health officials are urging people to consider to help slow the summer surge of COVID-19. ABC 7 News reporter Gloria Rodriguez spoke with some experts about the issues. She joined us live now in studio. And Gloria, what advice are they giving?
Well, Julian, one expert tells me even if some people mask up in indoor crowded spaces, it will decrease some COVID transmissions and also raise awareness. According to the Centers for Disease Control and Prevention, California is now one of 8 states where COVID-19 wastewater viral activity levels are very high. Dr. Peter Chin Hong, an infectious disease specialist at the University of California, San Francisco, says there are a few reasons for this rise in COVID cases, including more summer travel, less people getting vaccinated, and the recent heat wave here.
I think California and the Bay Area, as an example, was ripe to seeing a lot of transmissions during the recent period of time. The heat waves made a lot of people go indoors. Also the wildfires. So it's almost like our version of winter when everybody's escaping the heat or wildfires congregated inside. A lot of noses and mouths together.
SF Public Health posting this alert on X, formerly Twitter, saying, with COVID-19 circulating, please consider wearing a well-fitted mask in crowded indoor spaces. Dr. Peter Chin Hong weighs in.
I think that the rationale is that there's just so much COVID going around right now that is with a very transmissible strain that it's going to be very easy to get it. And if you want to lower that risk, carrying a mask around in my pocket like I do and bringing it out when I feel a little bit at risk is probably not a bad idea. We've seen the highest levels of COVID for a long time in the Bay Area, probably close to 2022 summer levels and higher than 2023 summer levels. So a lot of people getting COVID. If we were talking about this in 2020, we'll be talking about ICU beds. In 2022, we'll be talking about hospital beds. This year, there's still hospitalizations that are ticking up, but most of the cases are in the outpatient setting. They're in the community.
And you heard Dr. Chin Hong. He says the current variant is more transmissible. He says symptoms include the usual sore throat, congestion, runny nose, and fever. But he says that newer symptoms they're seeing more of are stomach symptoms such as nausea and vomiting. And he's recommending that those over 65 get the vaccine now if they haven't, and get the new one in October. By then, it's expected to come out. Live in the studio, Gloria Rodriguez, ABC 7 News.
Gloria, thank you.